on the web, and in your hands. This is MDiTV.
To be blunt about it, a lot of people think the obesity epidemic is caused by fat people, that lung cancer can be blamed on smokers, and heart disease on people who just don't exercise enough. Certainly what we do affects our health, but the overwhelming focus on individual behavior simply doesn't square with a lot of the science on major public health issues. And if you want to find somebody to blame for that mismatch, well, a recent study concludes you're looking at it. Me, us, the media, that is. The study published in the American Journal of Public Health looked at how newspapers covered topics related to the persistent gaps in the health of different racial and ethnic groups in the United States. Of the various causes of and potential solutions for these disparities, including genetics, behavior, healthcare, or social factors, what got covered? In almost 4,000 stories published in 40 newspapers between 1996 and 2005, the dominant explanation offered was individual behavior, though that behavior was often coupled with social and healthcare factors. University of Oregon professor Jessica Green, who was not involved in this particular study, says it's important to recognize how we're affected by the environment around us. For example, living in a low-income neighborhood has a more powerful influence on both behavior and health than many of us realize.
A low-income neighborhood could influence people's health because this would be high crime rate, and so people are getting less physical activity, and there's less fresh produce available because there's no big supermarket. But also there's probably poorer education, and so you would be talking about needing to improve the educational system. And healthcare quality in low-income neighborhoods is also typically not as good, and so you need to raise the healthcare quality. So we're not talking about just health issues, we're talking about trying to bring business and supermarkets into low-income neighborhoods. We're trying to reduce crime rates, and we would need to improve education. So it's just incredibly broad, and as a result, it's not a simple task.
The authors of this newspaper study reported that social influences were included in some stories, but the coverage was still tilted toward individual behavior in ways that are out of sync with public health research findings. They also found that news coverage of racial and ethnic health disparities dwindled over time. Their journal article concluded the declining coverage of racial and ethnic health disparities and the media bias toward individual-level explanations may partly explain why the public is largely unaware of disparities in health and why people in our society prioritize individual responsibility for health problems. Okay, point taken.